Well, more frontline workers are expected to receive the COVID-19 vaccine today. 80,000 Johnson & Johnson doses hit our shores this week. Healthcare workers are first in line for the jab. eNCA's Heidi Jockers is watching developments and joins us now. Heidi, good to have you and good morning to you. Yesterday, seeing the president there, including the health minister and, the first nurse in Kylie getting the jab, got, the country quite optimistic. Just recap for us what exactly happened.
Yes, most certainly. I think it was quite an optimistic day for South Africa, given the setback that we experienced due to the AstraZeneca vaccine being put on hold. We received our first batch of 80,000 Johnson & Johnson vaccines, and yesterday we saw healthcare workers together with the president, the health minister and a number of NECs receiving that first jab. Of course, one must remember that with the Johnson & Johnson vaccine, you only need one jab, which of course makes it a lot easier to administer. But what's interesting here, Tumelo, is that there were many questions raised about why the Johnson & Johnson vaccine was rolled out immediately. If one remembers, with the AstraZeneca vaccine, we were supposed to send it off to Bloemfontein for 2 weeks for quality check and to actually make sure that it is a COVID-19 vaccine. But with this Johnson & Johnson vaccine, we do know that South Africa is the only country that's administering the vaccine for now, while it's still being registered in a number of other countries, and the US still deciding on whether or not it's going to administer this vaccine. But we spoke to Mia Malan, who explained to us why exactly this vaccine is being administered and rolled out immediately, and why there is no period where we will wait for about 2 weeks before it's administered. Let's listen to why this is happening.
This vaccine is brought into the country with a different type of SAHPRA, our medicine regulator registration, than what the AstraZeneca vaccine was brought in. And the big difference is that this batch of Johnson & Johnson vaccines can only be used as part of a research setting, so in an implementation trial that we're implementing. And the reason we did that really was to get the vaccine quicker into the country, because Johnson & Johnson has also applied for wider registration, but that registration takes about 3 months, and they started to apply towards the end of last year. So we're only looking towards the end of February or March for that to be completed. And while that is being completed, this is the sort of stopgap measure to bring a vaccine immediately into the country, because the type of registration that you require for to use a vaccine in a research setting is very different. You can get it within a few days or a few hours almost from, I think in about 48 hours from SAHPRA, and that is why it doesn't have to go to Bloemfontein for tests.
Any plans announced, Heidi, just in terms of, moving forward with the vaccine? We know 80,000 doses will be administered, but what other plans does government have?
So government has indicated that they will be getting more batches in the next 2 weeks or so. So almost every week we'll be getting a batch. We know that so far we're getting 4 batches, 3 of 80,000 and then 1 of 60,000. And then we know soon after that, if Johnson & Johnson is confident and sees that we are able to administer the vaccine, we could get more batches. But we do understand yesterday from what the health minister said, Dr. William Kize, that they are planning on getting about 500,000 of Johnson & Johnson vaccines, and of course they are trying to get other vaccines from other manufacturers. So there are definitely plans in the pipeline to secure as many vaccines as possible, and of course to try and inoculate the majority of our healthcare workers, which is about 1.5 million. So far we do know that the rollout vaccine is underway, but what's key here, Tumelo, is also to try and figure out when private healthcare workers will be included in this, given the fact that they have not been necessarily involved in the first batch. But we do know that there are discussions and the health minister indicating that indeed private healthcare will most likely get 30% of the 80,000 batches. But we're still waiting further clarity on that to try and establish what exactly it means for private healthcare as well.
All right, Heidi Jockers, thank you so much for this update.